Hi, and welcome all. A typical 2-year-old can say about 50 words and can speak 2 to 3 word sentences. By age 3, their vocabulary increases to about 1,000 words and they can speak in 3 and 4 word sentences. If your toddler hasn't met those milestones, they may have a speech delay. Developmental milestones for progress is just a general guidelines. It doesn't always mean that something is wrong. You may simply have a late bloomer who will be taking your ears off in no time. A delay in speech development may be a symptom of many disorders, including mental retardation, hearing loss, an expressive language disorder, psychosocial deprivation, autism, elective mutism, receptive aphasia, and cerebral palsy. So joining me online today is Usha Boola, who is a pediatric speech therapist who has been practicing for about 25 years, and further we'll listen from her. So let's get on to her. Yes, hi Usha, morning first of all, and thanks a lot for joining.
Hi Kiran, thank you. Thanks for this opportunity.
Okay, so my first question is as to my knowledge that in general at particular age, if child's milestone doesn't match and has a speech delay is alarming. So what would you say about it? And when should parents seek speech therapist help in their child's speech delay problem?
Okay, so when a child, usually parents get concerned if a child is, behind their peers, they haven't developed their milestones, as you're saying, okay? And usually speech and language develops like rapidly from about 18 months. So if parents notice that the child is delayed, they're not talking, it's best to get advice, okay, rather than leave it. Some children do take longer to develop, which can be normal as well. But sometimes they just need a little bit of stimulation, to get them going. So it's never too late or never too early to start. But we normally say from 18 months if you're concerned, consult a speech therapist.
Okay. Another question is what are the causes of speech delay?
Okay, there are quite many causes. It's very difficult to always identify what the cause is. So from as early as like pregnancy, so prenatal causes could be alcohol abuse, drug abuse during pregnancy. At birth, if there's hypoxia at birth, so the child doesn't get enough oxygen to the brain, that can also cause speech problems. You get your normal developmental delay that you asked me about earlier. So a child is fine, but just the milestones are delayed. You also get your oral motor problems where the messages from the brain to the oral structures is delayed or doesn't work properly. So the child has difficulty forming its mouth, making the right shapes, the movement for words. Okay. Then you also get neurological causes like your cerebral palsy, Down syndrome, and if there's any trauma or head injury when the child is quite young. One of the most important causes and things that we see quite often is ear infections. Okay, so what happens is the child might have otitis media, glue ear, and sometimes it goes undetected. So the parent won't even be aware that there is an ear infection. So this can cause quite a significant loss. And if like the child doesn't get treatment, doesn't get grommets, there can be permanent hearing loss. So that will affect the development of the speech and language.
Okay, so I've also heard about talking to children in like a baby talk, like babble in their young age, can cause their language barrier.
Okay, baby talk is quite normal, quite common. So when the baby is quite young, parents will use this high-pitched kind of voice, raising it, repeating words like saying baba, mama. Okay, and this early talk we call parentese. So it's quite normal and it's quite important actually for the baby's development. So when the baby is young, it's fine. But as the child's development progresses, sometimes you find parents using words like, oh, you want num num for food, or, woof woof for dog,
Yes,
you know,
yes.
things like that. So as the child gets older, we recommend not using like words like that, but to use the proper words. Okay, because that's gonna you need to be a good model for your child. So to use proper words, proper language to stimulate the child's language development.
All right. So now in regards to stuttering or stammering, can this be treated, and from which age should we just, focus on this, like, should seek any speech therapist help?
Okay, so stuttering is where the child's normal flow of speech is interrupted. Okay, so we get developmental stuttering in children. It's quite common from, like, say, 2 to 5 years of age, and it can start quite suddenly. So it's quite concerning for parents. Okay, the causes is difficult to say what causes it. There's a lot of genetic factors. So if there's a family history of stuttering, it's more likely to be seen in family members.
Right.
Yeah, there's quite a strong genetic link. And then also environmental factors. So if there's any instability in the home, separation anxiety, issues at home, emotional issues, things like that can affect a child. It's quite sensitive and lead to stuttering. Also, sometimes if there is a speech and language delay, the child might also stutter because the child's trying to find the words, the language to express himself.
Okay.
So at this age, it's quite common. It's important to monitor it. We usually tell parents not to react to the stuttering. So to try ignore it, but give the child attention. So look at the child, listen to the child, give the child attention and the time to say what he or she wants to say. We find that drawing attention to the stuttering, so often parents might say, "Oh, stop, why are you speaking like that? Say the word again." That draws attention to the speech and can even make the stuttering worse. So if parents find, look, it's not going away, and the child's maybe 5 or 6 and is beginning to interfere, say, with school, with communication, then it's important to see a speech therapist.
All right. Okay, now, what could be the therapies which can be helpful now for the children's speech delay?
Just for speech delay?
Yes.
Okay.
And then we can discuss for stuttering or stammering later on. But for now, speech delay, what would be the therapies?
Yes, so it depends also what the delay is. Some children are delayed in terms of the pronunciation of words, so they can't say certain sounds like the R, the L, the TH, so then we actually work on teaching the child how to say the particular sound. And so you go through stages where the child has to listen to the sound, identify the sound, try practicing the sound on its own, and then in words. So it's quite a long process. If the child's language is delayed, we usually work a lot on, like, say, using different themes and play and games to try and stimulate the child. So say we'll talk about farm animals, discuss the animals, how they look, what features they have, what they eat, where they live, to try and stimulate the vocabulary and the language through that.
Okay. So now we can talk about some stammering and stuttering therapies as well. What would you suggest?
Okay. Yes. Basically, we just try and get the child to use more what we call easy, relaxed speech, easy movement, which allows the words to flow. So we start with very light contact, with the lips, so no pressure, no tension. We try and do a lot of breathing, relaxation to try and get the child relaxed. And then just a slow, smooth speech. So it's very difficult to teach a child particular techniques that you would use with an adult. So we just call it like slow, smooth speech.
All right. So now, does speech delay has any link with hearing, particularly with nervous system?
Yes. Okay. So I did mention before. So speech delay is linked to hearing problems. There's quite a lot of research that shows with hearing problems, the speech is delayed, because if they have a loss in those frequencies, they're not going to develop all those sounds.
Yeah, but particularly does it? Sorry, but particularly does it relate to the nervous system also?
Not really the nervous system.
Okay.
But just more the auditory pathway. Yeah.
Okay. Now, for the speech delay, can be treated like, suppose how long would it take, and the procedure or the process of therapy? What do you think? Like, suppose we just starting from the beginning. If a child is 2 years old, and yeah, the parents, like, they sensed it. Now this is a problem. They have just come to you and they have started the therapy. So how long would it be taking for the whole procedure? And like, what were the chances of betterment or for improvement?
Okay, yes. We always say it's difficult to give a time limit for therapy. So I always say minimum 6 months, okay? Because therapy is usually once a week. And especially with the little children, what we do is we try and advise the parents on how to stimulate the child at home, because they spend a lot of time with the child. So for a 2-year-old, we'll show a parent how to play with the child, what language to use, because children learn through play, basically. So it'll be a minimum period of 6 months. Look, if there's no other factors and the child is just delayed, therapy does help quite quickly. It's quite effective. And especially if a child is also then in a preschool or in a play group where child is being stimulated as well, the child can make progress quite quickly.
Okay, so now my last question will be related to this. Like, what parents can do at home in regards to therapies? You're like, well, if you just say it so that they can speak to them, apart from this, what else they can do for the therapies for children?
Yes, I always advise parents, look, whenever they have time with their kids, to make it quality time. They don't need a lot of time. It must just be quality time. So just to sit and play with their kids, use a lot of language, use a lot of words, and read to their kids and talk to their kids. A lot of parents these days go to work, so there isn't time. So it's very difficult. Right. So even that 15 minutes or half an hour can be enough to spend with your child.
Can there be any good toys for parents to, inculcate children to buy, and then they can, use them in their child's speech delay? If you can tell.
Yes, so basically, construction toys are good. So like building blocks, things, because you can use a lot of language and you can do a lot of things with it. And also interactive toys. So things like cars, things like animals, obviously look at things that are appropriate for your child. Those are things basically most children enjoy, even simple floor puzzles, because they love being on the floor, and it's good sometimes for the parent to get on the floor so you're on the same level as the child. So those big floor puzzles are also a very good idea.
Okay, and in regards to poems and poetry and songs and rhymings, does that help also for children, speech delay problem?
Yes, actually, nursery rhymes and songs are very important for children. That's how they also learn language. They learn about the rhythm of language. They learn about rhyming, because you find with the nursery rhymes, all the words rhyme. And that's quite important. It actually is important for later skills, for later language and rhyming skills, and when they have to actually write their own poems. So that's very important that kids still have exposure to that.
Okay, Usha, it was really, really an insightful session with you, and I'm going to end it here now, but definitely I would just call you for another session some other time as well. So I would want you to just, share your contact detail for my viewers, so then how can they get hold of you?
All right, I do work at the schools in Benoni. I also work at the ECI Center in town. So yeah, you can contact me by email or WhatsApp.
Okay, and I would also, from my side, I would just share your contact details in the description box as well. Thanks a lot for joining. Have a wonderful day.
Okay, no problem. Thanks so much. Thank you. Thanks a lot.
Bye.
Bye-bye.
Bye.